Bismillahirrahmanirrahim. Assalamu alaikum. This is Dr. Ghufran Babar. I'm a pediatrician and an endocrinologist in US. So today's video will be on virtual interview questions. Please watch my video on virtual interview techniques and tips for that so that I made before this video. So this is a continuation of that video. So today's video will be on nitty-gritty things. What would you be asked on a virtual interview? How will you answer their questions? So before we proceed, please like this video, subscribe to my channel so that you stay in touch with my upcoming videos. Thank you. So the first thing is you need to understand that this virtual interview is an opportunity for yourself to sell yourself as a product which is very precious. So you want to present yourself as someone who is really qualified for the position and they should hire you. So that is the way you will go about this interview. Do not feel disappointed or feel that, okay, I'm just going through this interview, they may not hire me or match me. Just be positive because that is your opportunity to shine. So be positive during this interview and show that energy during the interview process. Make sure you have printed out everything in your ERAS application so that all the information that you have put in there is handy for your reference in case they ask you something, so that you don't mess up with the dates. You can always ask, excuse me, can I look in my papers, whatever I have documented in my ERAS application. Your personal statement is very important because remember, they don't have opportunity to meet you in person. They cannot take you out for a dinner. So there are a lot of things that they will try to understand about you with this virtual interview. So you need to have that information on the table as well as in your brain, whatever you have documented. A lot of candidates may apply for more than one residency, more than one type. They may apply in internal medicine, pediatrics, psychiatry, family medicine, etc. So you want to be sure that if you are taking the interview for, say, internal medicine, you need to know whatever you wrote in your internal medicine personal statement as well as in the application in terms of your goals, your experience, your letters of recommendation that you have uploaded. So you have to have all that information in your mind and you should be mentally there in the interview. Usually they may ask you, because they don't know you, that tell us about yourself or tell me about yourself. So you have to rehearse things about yourself, briefly your educational background, why do you want to do internal medicine, any scenario that led you to choose this field. So rehearse that story that you will narrate it to them. So rehearse that story. Whatever story you have written down in your personal statement, make sure it is well rehearsed and it looks natural. It's not just like, yo, this thing happened, this thing. So you don't need to just it should not look artificial. It should look more natural. So more you will practice, it will have more confidence in yourself. Try to express by looking at the camera, record your personal statements or whatever story you will tell and listen to it. And have someone else listen to it so that they can pick some mistakes and critique it. So that is very important. So your current position, they can ask, what are you doing currently? Whether you are doing a clinical rotation, you're doing research, you are working in a hospital, They may ask you, what have you done after medical school? Like in India and Pakistan, they may do a year of internship, 6 months each. So they may ask you, which one are you doing now? You have done it. And if you completed 1 year, after that 1 year, preferably you should be in some sort of a clinical, hands-on experience rotation. Clinical, hands-on experience. That goes a long way, and preferably in the field where you are applying. Because if you're applying in internal medicine and you're doing a PEDS hands-on rotation, it will not reflect as well as it should, because you're doing something and you are applying in some different thing. So that also goes a long way. And they may ask you, about your future, that what would you like to be 10 years from now? What are your goals after residency? You want to do a fellowship, although sometimes it's too early to tell what you would like to do. But if you have a clear mind, oh, I want to do cardiology, I want to do GI fellowship, I want to do geriatrics, I want to do a child psych fellowship. So whatever is in neurology fellowship, try to show and have a story for it. That will be a very, very, very important thing for you during your interview. They may ask you, what are your strengths? Why should we hire you? So you should give out your strengths, that, okay, I have done well in my medical school, say you were in top 5% of the school, or I was very active with all the studies as well as extracurricular activities. I was someone who would go on medical camps, free medical camps. I would be someone who would be arranging blood for needy people in underdeveloped world. That's how it goes. So that really helps, knowing that the humane part of you, that you were not just a medical student studying, but there was other part of your life. You like the sports. They may ask you, what else do you want to do? What are your hobbies? You have kids, you want to play with them. If you like to read some books, you want to watch TV, sports channel, whatever you do should be a knee-jerk answer, and you should answer it with an intent of sharing a story about yourself, with an intent of informing them, not a computerized interview or computerized intervention. You are not a computer. You have to bring yourself into interview. Then they may ask you, why have you chosen this program? Why not some other program? So, or what special thing you like about this program? So you need to make sure that you search about this specific program, make a folder, make a catalog. Okay, I'm applying to internal medicine program to this hospital, and these are the number of positions, these are the residence salaries, this is the resident education program, this is the medical benefit, this is the opportunity of matching in fellowship programs, this is the number of faculty, where else they go for rotations. So most of the programs have their web page, so you can print it and put it in your folder or make a file on your computer, whatever is easier for you. But you need to know that program, the program directors, the chief residents, so that you feel at home meeting with those people when you really meet them, and you know about their program, and they know that this guy is really, really interested in our program. They may ask you, about a program, about a problem. That, okay, did you have any problem during your rotation? Or give us, give us an assessment of opportunity in which you were involved, in which there was a difficult situation that you had to deal during your medical student life or during your clinical life, that really that you really took part in it, and just give us a scenario or a case. So make sure that there is a situation, there is a child. I'm just giving you a child situation since I'm a pediatrician, coming in with a barky cough. You have tried dexamethasone, racemic epinephrine because the child had a storoider. You called the anesthetist, the child was worsening, needed a tracheostomy or intubation, and was admitted in the hospital, was monitored carefully, and eventually the child got better, and you saw that patient as an outpatient for follow-up, and you were really pleased that you did a good intervention, or you were the part of the team resuscitating that patient in the ER. The patient came with status asthmaticus. The patient goes into respiratory failure, respiratory and cardiac arrest. His CPR is done, revival is made, intubation, and the child is transferred to PICU. You go back and follow up on the patient recovers, gets better. So all these things make up a story, and then explain it to them carefully and rehearse that story, that okay, this was a situation, and usually there is a star mnemonic people use: situation, as for situation, the patient which is critically sick, then tasks performed. You ordered racemic epinephrine, or you ordered patient has MI, you suspected it and it was a positive chest pain, patient came with vague chest pain, you ordered troponin levels and EKG, and that comes out to be a positive test, and then you admit the patient. So you took an action. So S for situation, T for task, A for an action, and then the result that you the patient was transferred to PICU, needed to go into cath lab urgently, got the angiocat done, and was healthy and left the hospital. So that kind of case building, rehearse the story. The more you will rehearse the story, the more comfortable you will get during the interview. They may ask you, if there was any error you have made and how did you handle it. It's always good to admit that, okay, I did a little mistake here, where I realized, I informed my senior, I discussed with my attending, my professor, and we were able to correct it, so that you indicate that, okay, I am cautious enough to pick a mistake, and I'm always ready to correct it by using a team approach, making sure you talk with a senior resident, your attending, whosoever is on call, so that things get under control. They may ask, what are your weaknesses? That is a very common interview question. What are your weaknesses? So bring out the positive weaknesses, like, okay, my weakness is I am detail oriented. I want to pay attention to every little detail that sometimes I may take a little longer time, but eventually I want to find everything about my patient. So you are detailed. Or I'm a very hardworking person. Sometimes I tire myself too much by working too hard, but that's how my nature is. I try to make sure I finish my task before I leave the hospital, so that I don't have anything left over, and sometimes I get late or I overwork. So bring out a weakness, which indirectly is a good thing for a program, that we have someone who's really detail orienting, hardworking, doesn't want to get out of the hospital, wants to stay, finish the task, and does a great job. So that is another thing that you have to make sure that you rehearse before the real interview. And during the interview, when you always give a case, show compassion and love towards your patient, and that you're worried about someone. You call your senior about an abnormal lab, so show compassion. They may ask you, how would you handle a code, a death situation? How are you gonna do? Make sure you tell them that you will use the social services. You will explain the diagnosis. If there's a difficult diagnosis, say a child is born with ambiguous genitalia, you explain the situation to the family. You use the social services. You bring the psychologist. you're attending, endocrinologist, geneticist. So it's a team effort. So don't hesitate to use other resources when you are in a difficult situation. The interviewers, they also want to hire someone who is a team person. So make sure that you tell them you are very nice to your juniors, you're very nice to your seniors. That kind of approach that you will indicate that what is your strength. I want to work as a team. I get along very well with my seniors, and people like me. The nursing staff appreciates my effort. I received an award for being a good resident during my 6 months rotation. So all those things, the qualities that you have to bring them out, so that during this short time that they have to assess your personality and to determine that you are a good fit for them is fully utilized, so that you don't miss out on your good qualities just because you did not bring them out. So and during all this interview, stay positive. Don't lose energy during the interview. So a lot of times people start interview well, and in the middle of the interview, they just slow down or they get distracted. Make sure your buzzer is off, your cell phone is turned off, so that you are not distracted. You are in the situation and you're reminding yourself, I have to bring my A game. I have to prove myself that I am the best resident that they are going to hire. They should not forget their experience with me. So your pleasantness, your smiling, your being on time, your background, illuminated background, your computer, your cell phone, you're looking in the center and your confidence is there. All those things contribute, and you really express your interest to join their team. So that is the confidence, the energy, the compassion, the humbleness that you have to bring out in that 15 to 30 minutes interview, so that they don't forget you as an interviewee. Just remember, they should not forget you. That's how you should remember the stories that you have in the personal statement, the tasks that you have performed, the case that you will describe should be on the tip of your tongue, should be well rehearsed. Remember, well rehearsed, and narrate it in the form of a true story instead of just going through motionless. So try to create some drama, but should not be overly acted. So don't do any overacting, but still take them in that story so that they feel a part of that story that you are trying to express. So hopefully these findings would be good for you. These instructions, these tips will help you during your interview, the virtual interview that you will have this year. I wish you best of luck, and I hope all of you get matched in the programs that you really want to go. And God bless you all. Please like this video and subscribe it, so that you can see my upcoming videos. Thank you. God bless you. Sallallahu alaihi wa alihi wa sahbihi wa sallam. Thank you. Assalamu alaikum.